Question 1. Assessment of a patient presenting with shortness of breath and chest discomfort requires the Certified Clinical Medical Assistant, CCMA, to observe their chest for any abnormalities or signs of distress. What is the most appropriate method for the CCMA to perform this assessment while upholding patient rights and professional standards? Option A. Observe the patient's chest for any abnormalities without verbal explanation or draping, as the clinical need is paramount. Option B. Wait for the patient's spouse to arrive before performing any visual assessment of the chest to ensure family involvement. Option C. Explain the need for observation to the patient, ensure they are appropriately draped, and then proceed with a visual assessment of their chest. Option D. Discuss the patient's chest findings with a colleague in the hallway while preparing for the assessment. The correct answer is C. Explain the need for observation to the patient, ensure they are appropriately draped, and then proceed with a visual assessment of their chest. Explanation. This scenario presents a professional challenge due to the need to accurately assess a patient's cardiovascular status while respecting their privacy and ensuring their comfort, all within the scope of practice for a Certified Clinical Medical Assistant, CCMA, under U.S. federal regulations, specifically HIPAA. The CCMA must balance the clinical necessity of observation with the patient's right to dignity and confidentiality. The correct approach represents best professional practice because it prioritizes patient dignity and privacy while still allowing for essential clinical observation. By explaining the procedure and draping the patient appropriately, the CCMA adheres to ethical standards of care and the patient's right to informed consent and privacy as mandated by HIPAA. This demonstrates respect for the patient as an individual and builds trust, which is crucial for effective healthcare delivery. An incorrect approach that involves observing the patient without explanation or proper draping would be a violation of patient privacy and dignity, potentially leading to a breach of HIPAA regulations. This failure to obtain implied or explicit consent for observation and to maintain a professional demeanor undermines the patient-provider relationship and could result in patient distress or formal complaints. Another incorrect approach, such as delaying the assessment until a family member is present, might be well-intentioned but could compromise timely clinical evaluation. While involving family can be beneficial, the CCMA primary responsibility is to the patient's immediate clinical needs within their scope of practice, and delaying assessment without a clear clinical contraindication is not best practice. This could lead to a missed opportunity for early detection of a critical cardiovascular issue. A further incorrect approach, such as discussing the patient's condition with another staff member in a public area, would be a direct violation of HIPAA privacy and security rules. Protected health information, PHI, must be discussed in private settings to prevent unauthorized disclosure. This failure to safeguard patient information is a serious ethical and regulatory breach. The professional decision-making process for similar situations involves a systematic approach. 1. Identify the clinical need for assessment. 2. Consider the patient's rights to privacy, dignity, and informed consent. 3. Determine the actions within the CCMA scope of practice. 4. Communicate clearly and respectfully with the patient. 5. Implement the assessment in a manner that upholds both clinical effectiveness and patient rights. 6. Document the assessment accurately. Question 2. Comparative studies suggest that patient adherence to recommended medical procedures can be influenced by a complex interplay of cultural, religious, and personal beliefs, sometimes leading to significant ethical dilemmas for healthcare providers. A Certified Clinical Medical Assistant, CCMA, is preparing to assist with a minor surgical procedure. The patient, who is a devout follower of a specific religious doctrine, expresses strong reservations about the procedure due to a belief that it interferes with a spiritual aspect of their bodily integrity. The CCMA has been trained on the procedure and understands its medical necessity and potential benefits for the patient's health. What is the most ethically appropriate course of action for the CCMA in this situation? Option A. Proceed with preparing the patient for the procedure as scheduled, assuming that the medical necessity outweighs the patient's personal beliefs, and inform the physician of the patient's initial hesitation. Option B. Inform the patient that their beliefs are not medically sound and that refusing the procedure could lead to serious health complications, implying that their decision is irrational. Option C. Respectfully acknowledge the patient's beliefs, provide clear and unbiased information about the procedure's benefits, risks, and alternatives, answer any questions the patient may have, and document the patient's informed decision. Option D. Gently attempt to persuade the patient that their religious beliefs are not medically relevant to this specific procedure, and encourage them to reconsider their decision for their own well-being. The correct answer is C. Respectfully acknowledge the patient's beliefs, provide clear and unbiased information about the procedure's benefits, risks, and alternatives, answer any questions the patient may have, and document the patient's informed decision. Explanation. Scenario analysis. This scenario presents a professional challenge because it involves a patient's deeply held personal beliefs that conflict with standard medical recommendation, creating a tension between patient autonomy and the medical assistant's duty to provide care. The medical assistant must navigate this ethical minefield while adhering to professional standards and patient rights. Correct approach analysis. The correct approach prioritizes patient autonomy and informed consent, which are fundamental ethical principles in healthcare. By respectfully acknowledging the patient's beliefs, providing clear and unbiased information about the procedure's benefits and risks, and documenting the patient's decision and the information provided, the medical assistant upholds the patient's right to make decisions about their own body, even if those decisions differ from medical advice. This aligns with the ethical guidelines for medical assistants, which emphasize patient-centered care and respect for individual values. Incorrect approach is analysis. Failing to acknowledge the patient's beliefs and proceeding with the procedure without fully addressing their concerns disregards patient autonomy and can be considered a violation of ethical practice. It assumes the medical assistant knows what is best for the patient without fully understanding their perspective. Attempting to persuade or coerce the patient into accepting the procedure, even with good intentions, undermines their right to self-determination and can create a coercive environment. This crosses ethical boundaries by prioritizing the medical provider's judgment over the patient's informed choice. Dismissing the patient's beliefs as irrational or uninformed is disrespectful and unprofessional. It erodes trust and prevents open communication, hindering the ability to provide truly patient-centered care. This approach fails to recognize the diverse reasons individuals may hold certain beliefs. Professional reasoning. Professionals should approach such situations by first actively listening to and acknowledging the patient's concerns and beliefs without judgment. Then, they should provide clear, accurate, and unbiased information about the medical necessity, benefits, risks, and alternatives of the recommended procedure. This information should be presented in a way that the patient can understand. The professional must then ensure the patient has had the opportunity to ask questions and that their decision is voluntary and informed. Finally, all discussions and the patient's final decision must be meticulously documented in the patient's record. This process ensures ethical practice, respects patient rights, and maintains professional integrity. Question 3. System analysis indicates that a certified clinical medical assistant, CCMA, is reviewing patient charts and preparing to assist with a physical examination. The CCMA needs to understand the underlying muscle types and their primary functions to accurately interpret patient symptoms and document findings. Which of the following correctly categorizes a muscle type and its primary function relevant to clinical practice? Option A. Cardiac muscle, responsible for involuntary contractions that pump blood throughout the body. Option B. Smooth muscle, responsible for voluntary movements of the body. Option C. Skeletal muscle, responsible for involuntary contractions that move substances through internal organs. Option D. Skeletal muscle, responsible for involuntary contractions that regulate digestion. The correct answer is C. Skeletal muscle, responsible for involuntary contractions that move substances through internal organs. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the medical assistant to accurately identify muscle types and their primary functions in the context of patient care and documentation. Misidentification or misunderstanding of muscle function can lead to incorrect patient education, improper assistance during physical examinations or procedures, and inaccurate charting, all of which can impact patient safety and the quality of care. The CCMA must possess a foundational understanding of musculoskeletal anatomy and physiology to perform their duties effectively and ethically. Correct approach analysis. The correct approach demonstrates a thorough understanding of the distinct characteristics and roles of skeletal, smooth, and cardiac muscle. Skeletal muscles are voluntary, responsible for movement, and are striated. Smooth muscles are involuntary, found in internal organs, and control processes like digestion and blood vessel constriction. Cardiac muscle is involuntary, found only in the heart, and responsible for pumping blood. This knowledge is crucial for a CCMA when assisting with patient assessments, understanding patient complaints related to movement or organ function, and accurately documenting findings. Adherence to these anatomical and physiological principles aligns with the CCMA scope of practice as defined by regulatory bodies, ensuring patient safety and competent care. Incorrect approaches analysis. One incorrect approach might involve confusing the involuntary nature of smooth muscle with the voluntary control of skeletal muscle, leading to misinterpretations of patient-reported symptoms related to digestion or bladder control. This failure to differentiate muscle types can result in providing inappropriate advice or documentation, potentially delaying proper diagnosis and treatment. Ethically, this represents a failure to provide competent care. Another incorrect approach could be to misattribute the function of cardiac muscle, perhaps associating it with voluntary movement or the contraction of skeletal muscles. This misunderstanding is a significant safety concern, as it directly impacts the understanding of cardiovascular health and patient conditions. Regulatory frameworks emphasize the importance of accurate knowledge in patient care. Such a fundamental error would violate this principle. A third incorrect approach might be to oversimplify the striated appearance of both skeletal and cardiac muscle, failing to distinguish their unique locations and functions. This lack of specificity can lead to confusion in documentation and patient communication, particularly when discussing conditions affecting the heart versus those affecting limbs. This demonstrates a lack of the detailed knowledge required for accurate clinical practice. Professional reasoning. Professionals should approach this by first recalling the fundamental classifications of muscle tissue: skeletal, smooth, and cardiac. For each type, they should identify its key characteristics: voluntary vs. involuntary control, location within the body, and microscopic appearance, striated vs. non-striated. Then, they should connect these characteristics to their primary physiological function. This systematic approach ensures accurate recall and application of knowledge, which is essential for effective patient care, accurate documentation, and adherence to professional standards and regulatory requirements. Question 4. To address the challenge of explaining bone structure and function to a patient recovering from a fracture, which approach best aligns with the certified clinical medical assistant's role and responsibilities within the U.S. regulatory framework? Option A. Explain the biomechanical forces acting on the skeletal system during gait and the principles of Wolff's law in bone remodeling. Option B. Detail the microscopic structure of osteons, the process of ossification, and the hormonal regulation of calcium homeostasis. Option C. List the names of all major bones in the appendicular and axial skeleton and their precise anatomical landmarks. Option D. Describe bones as the body's framework, providing support and protection for organs, and enabling movement through muscle attachment, using simple terms and checking for understanding. The correct answer is D. Describe bones as the body's framework, providing support and protection for organs, and enabling movement through muscle attachment, using simple terms and checking for understanding. Explanation. The scenario presents a common challenge in clinical settings where a medical assistant must accurately convey information about bone structure and function to a patient. This requires not only a foundational understanding of anatomy and physiology, but also the ability to translate complex medical terms into understandable language, adhering to patient education standards and scope of practice. The professional challenge lies in ensuring patient comprehension without overstepping the assistant's role or providing information that could be misinterpreted or lead to self-treatment. Careful judgment is required to balance thoroughness with clarity and to remain within the defined boundaries of the CCMA responsibilities. The correct approach represents best professional practice because it prioritizes patient understanding and safety by using clear, simple language and focusing on the essential functions of bone relevant to the patient's condition. This aligns with the ethical principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Specifically, it adheres to guidelines for patient education, which emphasize using lay terms and confirming comprehension. While the CCMA exam focuses on U.S. regulatory frameworks, general principles of patient communication and scope of practice are universally applicable and are implicitly covered by the CCMA training and certification, which are grounded in U.S. healthcare standards. An incorrect approach that involves using highly technical anatomical terms without explanation fails ethically and professionally by potentially confusing the patient, hindering their ability to follow treatment plans, and violating the principle of informed consent. This could also be seen as a failure to provide adequate patient education, a core responsibility. Another incorrect approach that delves into complex biomechanical principles or detailed cellular processes is inappropriate because it exceeds the scope of practice for a CCMA and could lead to misinformation or anxiety. This oversteps the boundaries of the CCMA role, which is to assist the physician and provide basic patient education, not to act as a specialist educator. A third incorrect approach that focuses solely on the structural components without relating them to the patient's condition or daily function is also professionally deficient. It lacks practical relevance for the patient and fails to empower them with actionable knowledge, thus not fulfilling the purpose of patient education. The professional decision-making process for similar situations should involve first identifying the patient's specific needs and the purpose of the education. Then, the assistant should access their knowledge base regarding bone structure and function, filtering it through the lens of what is relevant and understandable for the patient. The next step is to formulate the explanation using clear, concise language, avoiding jargon. Crucially, the assistant must then assess patient comprehension through open-ended questions and observe for signs of understanding. Finally, the assistant must recognize the limits of their scope of practice and know when to refer the patient to a physician or other healthcare professional for more in-depth information. Question 5. The control framework reveals that a patient diagnosed with malabsorption is struggling to understand why certain dietary modifications are recommended. Which explanation of digestive processes and enzymes best supports patient education in this context? Option A. Focusing on the visual appeal and palatability of foods, suggesting that enjoyable meals are key to a healthy digestive system. Option B. Describing the general sensation of fullness and how different foods contribute to it, without detailing the enzymatic breakdown. Option C. Discussing the role of the stomach's churning action in mixing food with digestive juices, without specifying the enzymes involved or their substrates. Option D. Explaining how specific enzymes like amylase, lipase, and proteases are crucial for breaking down carbohydrates, fats, and proteins, respectively, and how impaired function of these enzymes can lead to malabsorption. The correct answer is D. Explaining how specific enzymes like amylase, lipase, and proteases are crucial for breaking down carbohydrates, fats, and proteins, respectively, and how impaired function of these enzymes can lead to malabsorption. Explanation. This scenario is professionally challenging because it requires the medical assistant to apply knowledge of digestive processes and enzymes in a way that directly impacts patient education and understanding of their prescribed dietary recommendations. The medical assistant must accurately convey information about how specific foods are broken down to help the patient adhere to their treatment plan, which may involve avoiding certain foods or incorporating others. Careful judgment is required to ensure the information provided is scientifically accurate, easy for the patient to understand, and aligns with the physician's orders. The correct approach represents best professional practice because it demonstrates a thorough understanding of the digestive system's enzymatic actions and their relevance to dietary management. By explaining how enzymes like amylase, lipase, and proteases break down carbohydrates, fats, and proteins, respectively, the medical assistant empowers the patient with knowledge. This knowledge can lead to better compliance with dietary restrictions or recommendations, ultimately contributing to improved health outcomes. This aligns with the CCMA role in patient education and support, ensuring that patients can make informed decisions about their health based on accurate information. An incorrect approach that focuses solely on the taste or texture of food fails to address the underlying physiological processes. This is a regulatory failure because it neglects the CCMA responsibility to provide medically relevant information that supports patient care and treatment adherence. Another incorrect approach that oversimplifies the digestive process to a point of inaccuracy misinforms the patient, which is an ethical failure. Misinformation can lead to poor dietary choices, potentially exacerbating the patient's condition or hindering recovery. A third incorrect approach that introduces information about digestive processes unrelated to the patient's specific condition or prescribed diet is inefficient and potentially confusing, diverting focus from essential educational points, and thus failing to meet professional standards of care. The professional reasoning process for similar situations involves first understanding the patient's specific condition and the physician's treatment plan. Then, the medical assistant should identify the key educational points relevant to the patient's understanding and adherence. This involves recalling and applying knowledge of relevant physiological processes, such as digestive enzymes and their functions. Finally, the medical assistant must communicate this information clearly, accurately, and in a patient-centered manner, ensuring comprehension and addressing any patient questions. Question 6. Benchmark analysis indicates that a patient reports experiencing intermittent tingling and a sensation of pins and needles in their hands and feet, along with occasional mild weakness in their legs when walking. The Certified Clinical Medical Assistant, CCMA, is responsible for initial patient intake and vital signs. Which of the following approaches best reflects professional practice in this situation? Option A. Document the patient's reported symptoms accurately in the medical record and promptly inform the supervising physician or nurse practitioner of these findings. Option B. Reassure the patient that these symptoms are common and likely due to stress or fatigue, advising them to rest. Option C. Advise the patient to try over-the-counter pain relievers and monitor their symptoms for a week before seeking further medical attention. Option D. Perform a basic neurological assessment, including reflex testing and sensory evaluation, and then provide the patient with information on potential causes of neuropathy. Correct answer is A. Document the patient's reported symptoms accurately in the medical record and promptly inform the supervising physician or nurse practitioner of these findings. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the medical assistant to interpret and act upon a patient's subjective report of neurological symptoms, which can be subtle and varied. The challenge lies in distinguishing between normal physiological sensations and potential indicators of a serious neurological issue that requires immediate medical attention. Accurate assessment and timely reporting are critical to patient safety and effective treatment. Correct approach analysis. The correct approach represents best professional practice because it prioritizes patient safety and adheres to the CCMA scope of practice. By recognizing the potential significance of the patient's reported symptoms, e.g., tingling, numbness, weakness, as indicators of central or peripheral nervous system dysfunction, the medical assistant correctly identifies the need for further evaluation by a licensed healthcare provider. This aligns with the ethical obligation to advocate for the patient and ensure they receive appropriate medical care. Promptly notifying the physician or nurse practitioner allows for a timely diagnosis and intervention, which is crucial for managing neurological conditions and preventing potential complications. This action is consistent with standard clinical protocols for reporting new or worsening patient symptoms. Incorrect approaches analysis. One incorrect approach involves dismissing the patient's symptoms as minor or unrelated to a neurological issue. This failure to recognize potential signs of nervous system dysfunction constitutes a breach of professional responsibility and could lead to delayed diagnosis and treatment, potentially harming the patient. It neglects the principle of first, do no harm, and fails to uphold the standard of care expected of a CCMA. Another incorrect approach is to attempt to diagnose the condition or provide specific medical advice to the patient regarding their symptoms. This exceeds the CCMA scope of practice, which is limited to assisting licensed healthcare providers. Providing a diagnosis or treatment recommendations without proper medical training and licensure is a serious regulatory and ethical violation, potentially leading to misdiagnosis and inappropriate self-care by the patient. A third incorrect approach is to delay reporting the patient's symptoms to the supervising physician or nurse practitioner. This delay can have significant consequences, especially if the symptoms are indicative of an acute neurological event. It demonstrates a lack of urgency and a failure to prioritize patient well-being, potentially violating guidelines related to patient assessment and communication of critical findings. Professional reasoning. When faced with a patient reporting neurological symptoms, a CCMA should employ a systematic approach. First, actively listen to the patient's description of their symptoms, noting their location, intensity, duration, and any associated factors. Second, recognize that symptoms like tingling, numbness, weakness, dizziness, or changes in sensation can be indicative of nervous system issues. Third, understand the scope of practice, which includes observation, data collection, and reporting to the supervising licensed provider, but not diagnosis or treatment. Fourth, promptly and accurately communicate these findings to the physician or nurse practitioner, providing a clear and concise summary of the patient's reported symptoms. This ensures that the patient receives timely and appropriate medical evaluation and care. Question 7. The monitoring system demonstrates a patient's blood pressure reading of 155/95 mmHg and a pulse rate of 92 beats per minute. The patient is awake, alert, and denies any immediate discomfort, but their chart indicates a baseline blood pressure typically around 120/80 mmHg. What is the most appropriate immediate action for the certified clinical medical assistant? Option A. Administer a PRN antihypertensive medication as per standing orders. Option B. Document the readings and advise the patient to rest and drink water, assuming it will resolve. Option C. Remeasure the blood pressure and pulse in 15 minutes without informing anyone. Option D. Report the readings to the supervising physician or licensed healthcare provider. The correct answer is D. Report the readings to the supervising physician or licensed healthcare provider. Explanation. Scenario analysis. This scenario presents a common challenge in clinical settings where a patient's vital signs, specifically blood pressure and pulse, deviate from expected norms. The challenge lies in accurately interpreting these readings in the context of the patient's condition and determining the appropriate immediate action. Balancing patient safety with efficient workflow. Misinterpretation or delayed action can lead to adverse patient outcomes or unnecessary interventions. Correct approach analysis. The correct approach involves recognizing the significance of the elevated blood pressure and the slightly elevated pulse rate in relation to the patient's baseline and current condition. As a certified clinical medical assistant, CCMA, operating under U.S. regulatory frameworks, the primary ethical and professional obligation is patient safety. This necessitates immediate but measured action. Reporting the findings to the supervising physician or licensed healthcare provider is paramount. This allows for a timely clinical assessment and the formulation of a treatment plan, adhering to the scope of practice for a CCMA. This aligns with guidelines from organizations like the American Association of Medical Assistants, AMA, which emphasize the importance of accurate vital sign monitoring and prompt communication of abnormal findings to the physician. Incorrect approaches analysis. One incorrect approach involves ignoring the readings because they are not critically high, assuming they will self-correct. This violates the ethical principle of non-maleficence, do no harm, and the regulatory requirement to report significant deviations in vital signs. It could lead to a worsening of the patient's condition if the elevated readings are indicative of a developing issue. Another incorrect approach is to immediately administer a PRN medication without physician orders. This is a direct violation of the CCMA scope of practice, which prohibits independent medication administration. It bypasses the physician's clinical judgment and could result in inappropriate or harmful treatment, contravening federal and state regulations governing medical assistance. A third incorrect approach is to remeasure the blood pressure and pulse immediately without any other intervention or reporting. While remeasurement can be part of a protocol for borderline readings, in this case, the readings are significantly elevated and accompanied by a slightly elevated pulse, warranting more than just a simple recheck without informing the provider. This delays necessary clinical assessment and intervention, potentially compromising patient care. Professional reasoning. When faced with abnormal vital signs, a CCMA should follow a systematic decision-making process. 1. Assess the readings against the patient's baseline and clinical context. 2. Recognize deviations that require attention. 3. Communicate these findings promptly and accurately to the supervising physician or licensed healthcare provider. 4. Follow the provider's instructions for further action, which may include remeasurement, observation, or specific interventions. This process ensures patient safety, adheres to regulatory requirements, and upholds professional ethical standards. Question 8. Consider a scenario where a physician asks a certified clinical medical assistant, CCMA, to assess a patient's deep tendon reflexes as part of a routine physical examination. The CCMA has just completed a training module on neurological assessments. Which of the following actions best demonstrates adherence to best practices for reflex arc assessment and documentation within the U.S. regulatory framework for CCMA practice? Option A. The CCMA uses a reflex hammer to elicit the patellar reflex, observes the degree of knee extension, and documents the finding using a standard grading scale, e.g., 2+. Option B. The CCMA performs the reflex test quickly without ensuring the patient is relaxed, then documents that the reflexes were tested. Option C. The CCMA taps the patellar tendon lightly with the reflex hammer and notes in the chart that the patient's reflexes appear to be present. Option D. The CCMA asks the patient if they feel their reflexes are normal and records the patient's subjective response as the assessment finding. The correct answer is A. The CCMA uses a reflex hammer to elicit the patellar reflex, observes the degree of knee extension, and documents the finding using a standard grading scale, e.g., 2+. Explanation: scenario analysis. This scenario presents a challenge in accurately assessing a patient's neurological status, specifically their reflex responses, which are critical indicators of nervous system integrity. Misinterpreting or inadequately documenting these responses can lead to delayed or incorrect diagnoses, impacting patient care and safety. The medical assistant must possess a thorough understanding of normal and abnormal reflex patterns and the appropriate techniques for elicitation and documentation, adhering strictly to established clinical protocols and the scope of practice for a certified clinical medical assistant, CCMA, within the U.S. regulatory framework. Correct approach analysis. The correct approach involves systematically assessing the patient's reflexes using standardized techniques and accurately documenting the findings according to established medical charting practices. This aligns with the CCMA role in assisting with patient examinations and data collection. The CCMA is expected to follow physicians' orders and establish protocols for physical assessments, ensuring that observations are objective and precise. This approach upholds the principle of accurate patient record-keeping, which is a cornerstone of quality healthcare and is implicitly required by federal regulations like HIPAA concerning the privacy and security of protected health information, FI, which includes clinical findings. Furthermore, it supports the physician's diagnostic process by providing reliable data. Incorrect approach is analysis. One incorrect approach involves relying solely on the patient's subjective report of sensation without objective testing. This is a failure of best practice because reflexes are involuntary responses that cannot be accurately gauged by patient self-assessment. It bypasses the CCMA responsibility to perform objective clinical tasks as directed. Another incorrect approach is to perform reflex testing inconsistently or without proper technique, leading to unreliable results. This violates the principle of competent clinical practice and could misinform the physician. A third incorrect approach is to document findings vaguely or subjectively, such as reflexes seem okay, instead of using standardized grading scales, e.g., 0 to 4+. This lack of specificity hinders clear communication among healthcare providers and compromises the integrity of the patient's medical record, potentially violating standards for medical documentation. These failures can be seen as a breach of the professional duty of care and may have implications under state medical practice acts that define the scope of practice for medical assistants. Professional reasoning. When faced with assessing patient reflexes, a CCMA should first confirm the physician's orders or the established clinic protocol for reflex testing. They should then gather the necessary equipment, e.g., reflex hammer. The CCMA must employ proper technique for each reflex being tested, ensuring the patient is relaxed and the stimulus is applied correctly. Observations should be objective and graded using a recognized scale. Finally, all findings must be meticulously and accurately documented in the patient's electronic health record, EHR, or chart, using clear, concise, and standardized medical terminology. If any findings are unusual or concerning, the CCMA should report them promptly to the supervising physician or nurse. Question 9. The investigation demonstrates a patient presenting with fatigue, unexplained weight changes, and mood fluctuations. The medical assistant reviews the patient's chart and notes recent laboratory results showing elevated thyroid-stimulating hormone, TSH, levels and low free thyroxine, T4. Considering the negative feedback loop mechanism of the hypothalamic pituitary thyroid axis, what is the most appropriate interpretation of these findings for the medical assistant to report to the physician? Option A. The patient is likely experiencing a primary pituitary disorder causing the TSH elevation. Option B. The low T4 levels are the primary cause of the patient's symptoms, and the TSH is a secondary response. Option C. The symptoms are unrelated to thyroid function, and the laboratory results are within normal variation. Option D. The elevated TSH suggests the pituitary gland is attempting to stimulate a thyroid gland that is not responding adequately, indicating a potential issue with thyroid hormone production. Correct answer is D. The elevated TSH suggests the pituitary gland is attempting to stimulate a thyroid gland that is not responding adequately, indicating a potential issue with thyroid hormone production. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the medical assistant to interpret a patient's symptoms in the context of hormonal imbalances and feedback loops, a complex physiological process. The challenge lies in recognizing subtle signs that may indicate a disruption in this delicate regulatory system and understanding the implications for patient care and further diagnostic steps. Accurate assessment is crucial to avoid misdiagnosis or delayed treatment. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive understanding of the patient's hormonal status by considering the interplay of multiple hormones and their feedback mechanisms. This aligns with the CCMA role in assisting with patient assessment and data collection. By recognizing the potential for a feedback loop disruption, the medical assistant is demonstrating an understanding of the underlying physiology, which is essential for accurate reporting to the physician and contributing to effective patient management. This approach upholds the ethical principle of beneficence by ensuring the patient receives appropriate diagnostic attention. Incorrect approach is analysis. One incorrect approach fails to consider the interconnectedness of hormonal regulation. Focusing solely on one hormone without acknowledging how it influences or is influenced by others can lead to an incomplete or misleading assessment. This could result in the omission of critical information when reporting to the physician, potentially delaying diagnosis or leading to inappropriate treatment plans, which is a failure in the duty of care. Another incorrect approach might involve making a definitive diagnosis or recommending specific treatments. This oversteps the scope of practice for a certified clinical medical assistant. Medical assistants are trained to collect data, assist with procedures, and report findings, not to diagnose or prescribe. Such an action would violate regulatory guidelines regarding the scope of practice and could have serious legal and ethical ramifications for both the assistant and the healthcare facility. A further incorrect approach might be to dismiss the patient's symptoms as nonspecific or unrelated to hormonal issues without further investigation. This demonstrates a lack of understanding of how hormonal imbalances can manifest in diverse ways and could lead to patient harm by neglecting potentially serious underlying conditions. This failure to thoroughly investigate and report could be considered negligence. Professional reasoning. Professionals should approach such situations by first thoroughly reviewing the patient's presented symptoms and medical history. They should then consider the known physiological mechanisms, including hormonal feedback loops, that could explain these symptoms. The next step is to gather relevant objective data, such as vital signs and any available laboratory results, while always staying within their defined scope of practice. Finally, all findings and observations should be clearly and accurately communicated to the supervising physician, allowing them to make informed diagnostic and treatment decisions. This systematic approach ensures patient safety and adherence to professional standards. Question 10. Upon reviewing a patient's chart for an upcoming appointment concerning their muscle weakness, the Certified Clinical Medical Assistant, CCMA, is preparing to discuss the basic mechanisms of muscle contraction. The patient has expressed confusion about how their muscles are supposed to work. Which of the following approaches best ensures the patient understands the fundamental process of muscle contraction in a way that supports their care? Option A. Hand the patient a diagram of a muscle fiber and tell them to study it, stating that the visual representation should be sufficient for them to understand how their muscles contract. Option B. Begin by asking the patient what they already understand about how muscles contract, then explain the process using simple terms and a relatable analogy, pausing frequently to ask clarifying questions and confirm comprehension. Option C. Provide the patient with a detailed, technical pamphlet on the neuromuscular junction and actin-myosin interactions, assuming they will be able to interpret the complex scientific language. Option D. Explain the process using advanced physiological terminology, such as sarcomere shortening and cross-bridge cycling, without further elaboration, as this is the medically accurate description. The correct answer is B. Begin by asking the patient what they already understand about how muscles contract. Then explain the process using simple terms and a relatable analogy, pausing frequently to ask clarifying questions and confirm comprehension. Explanation. Scenario analysis. This scenario presents a challenge because it requires a clinical medical assistant to assess a patient's understanding of a complex physiological process, muscle contraction, in the context of their condition. The challenge lies in translating scientific concepts into understandable terms for a patient and ensuring their comprehension without overstepping the scope of practice. Accurate patient education is crucial for adherence to treatment plans and overall patient safety, making the assistant's role in this communication vital. Correct approach analysis. The correct approach involves a systematic assessment of the patient's current knowledge, followed by clear, concise, and tailored explanations. This aligns with the CCMA role in patient education and support, emphasizing clear communication and patient-centered care. The focus on using analogies and checking for understanding directly addresses the need to ensure the patient can grasp the information, which is essential for informed decision-making and adherence to their care plan. This approach upholds ethical principles of patient autonomy and beneficence by empowering the patient with knowledge. Regulatory frameworks for medical assistants typically emphasize the importance of accurate patient education within their scope of practice, ensuring that information provided is correct and understandable. Incorrect approaches analysis. Providing overly technical jargon without simplification fails to meet the standard of clear communication expected of a CCMA. This approach risks confusing the patient, leading to misunderstanding and potentially poor adherence to treatment, which could be considered a breach of the duty of care. It also fails to respect the patient's right to understand their health condition. Assuming the patient understands the concept without verification is a failure in patient assessment and education. It bypasses the crucial step of confirming comprehension, leaving the patient potentially misinformed. This can lead to incorrect self-management of their condition and may have negative health consequences, violating the principle of non-maleficence. Relying solely on written materials without verbal explanation or interaction is insufficient for many patients, especially those with limited literacy or who benefit from interactive learning. While written materials are a valuable supplement, they cannot replace the personalized interaction and clarification a CCMA can provide, nor can they guarantee comprehension. This approach neglects the individualized needs of the patient. Professional reasoning. Professionals should approach patient education by first assessing the patient's baseline knowledge and learning style. Then, they should use clear, simple language, incorporating analogies or visual aids where appropriate. Crucially, they must actively check for understanding through open-ended questions and by asking the patient to rephrase information in their own words. This iterative process ensures that the patient is not only receiving information, but also comprehending it, fostering a collaborative approach to their healthcare. Question 11. Market research demonstrates that patients often have questions about common musculoskeletal issues. A patient presents with generalized muscle soreness after a new exercise routine and asks the certified clinical medical assistant, CCMA, for advice on what might be causing it and what they should do. Which of the following actions best aligns with the CCMA scope of practice and regulatory guidelines? Option A. Provide a detailed explanation of advanced physical therapy techniques that could alleviate the soreness. Option B. Suggest specific over-the-counter pain relievers and topical creams that have worked for the medical assistant's family members. Option C. Diagnose the patient's condition as a severe muscle tear and recommend immediate rest and ice without physician consultation. Option D. Explain general principles of muscle strain and recovery. Advise the patient to consult with the physician for a diagnosis and personalized treatment plan, and reinforce any specific exercises or stretches previously prescribed by the physician. The correct answer is D. Explain general principles of muscle strain and recovery. Advise the patient to consult with the physician for a diagnosis and personalized treatment plan, and reinforce any specific exercises or stretches previously prescribed by the physician. Explanation. This scenario presents a professional challenge because the medical assistant must navigate patient education regarding a common musculoskeletal condition while adhering to the scope of practice and ensuring accurate, evidence-based information is conveyed. The challenge lies in providing sufficient detail to empower the patient without overstepping professional boundaries or providing advice that should come from a physician or physical therapist. Careful judgment is required to balance patient understanding with regulatory compliance and ethical responsibility. The correct approach represents best professional practice because it aligns with the CCMA role in patient education and support within their defined scope, providing general information about the muscular system and common conditions like muscle strains, emphasizing the importance of physician consultation for diagnosis and treatment, and reinforcing prescribed exercises are all within the CCMA purview. This approach prioritizes patient safety by directing them to the appropriate healthcare professionals for definitive care and treatment plans, thereby adhering to regulatory frameworks that define the scope of practice for medical assistants. It also upholds ethical principles of beneficence and non-maleficence by ensuring the patient receives accurate information and appropriate guidance. An incorrect approach that involves diagnosing the patient's condition or recommending specific over-the-counter medications without physician orders would be a significant regulatory and ethical failure. Diagnosing is outside the scope of practice for a CCMA, and doing so could lead to misdiagnosis, delayed appropriate treatment, and potential harm to the patient. Recommending specific medications without a physician's order is also a violation of scope of practice and could have adverse effects or interactions. Another incorrect approach, such as dismissing the patient's concerns or providing vague, unhelpful information, would be an ethical failure, demonstrating a lack of professionalism and potentially undermining patient trust and adherence to care. This could also be seen as a failure to provide adequate patient support, which is an expected component of the CCMA role. The professional decision-making process for similar situations should involve a clear understanding of the CCMA scope of practice as defined by relevant regulatory bodies. When faced with patient inquiries about their health, the CCMA should first assess if the question falls within their educational or supportive role. If the inquiry requires clinical judgment, diagnosis, or treatment planning, the CCMA must defer to the physician or other licensed healthcare provider. Patient education should be general, evidence-based, and reinforce instructions provided by the physician. Documentation of patient education and any referrals made is also crucial for professional accountability. Question 12. Examination of the data shows a patient reporting that their toes frequently become cold, numb, and turn pale when their legs are elevated, but return to normal color when the legs are lowered. The medical assistant has also noted that the patient's pedal pulses are difficult to palpate. Option A. Advise the patient that these symptoms are likely due to poor circulation from aging and recommend they wear warm socks. Option B. Document the patient's reported symptoms and the findings regarding pedal pulses and immediately inform the supervising physician of these observations. Option C. Explain to the patient that this is a normal physiological response and that they should avoid elevating their legs. Option D. Suggest the patient try a warm foot soak to improve blood flow and document that the patient was advised on home care remedies. Correct answer is B. Document the patient's reported symptoms and the findings regarding pedal pulses and immediately inform the supervising physician of these observations. Explanation. Scenario analysis. This scenario presents a common challenge in clinical settings where a medical assistant must interpret patient-reported symptoms related to circulation and determine the appropriate course of action. The challenge lies in distinguishing between normal physiological responses and signs of potentially serious underlying vascular conditions that require immediate medical attention. Misinterpretation could lead to delayed diagnosis and treatment, impacting patient outcomes. The medical assistant must rely on their knowledge of circulatory anatomy and physiology, as well as established clinical protocols, to make a sound judgment. Correct approach analysis. The correct approach involves recognizing that the patient's description of cold, numb toes that turn pale when elevated is a classic presentation suggestive of peripheral artery disease (PAD) or other circulatory compromise. This symptom complex, particularly the pallor upon elevation, indicates reduced blood flow to the extremities. As a certified clinical medical assistant, CCMA, operating under U.S. regulatory frameworks, e.g., scope of practice defined by state medical boards and professional organizations like NCCA, the appropriate action is to document the findings accurately and promptly report them to the supervising physician or licensed healthcare provider. This adheres to the principle of patient safety and the CCMA role in assisting with diagnosis and treatment planning by providing essential patient data. The CCMA is not authorized to diagnose or prescribe treatment, but is responsible for recognizing and escalating critical findings. Incorrect approach is analysis. One incorrect approach would be to dismiss the symptoms as minor or age-related without further investigation. This fails to meet the ethical obligation of providing competent care and could violate regulations requiring the reporting of potentially significant patient health information. Another incorrect approach would be to attempt to provide a diagnosis or recommend specific home remedies. This exceeds the CCMA scope of practice, which is strictly defined by regulatory bodies, and can lead to patient harm and legal repercussions for both the assistant and the practice. Offering reassurance without escalating the concern to the physician also represents a failure in professional responsibility, as it may lull the patient into a false sense of security while a serious condition goes unaddressed. Professional reasoning. Professionals should approach such situations by first activating their clinical knowledge base regarding the presented symptoms. They must then consider their defined scope of practice and the established protocols within their healthcare setting. Decision-making process should prioritize patient safety, which involves accurate observation, thorough documentation, and timely communication with the appropriate licensed healthcare provider. If there is any doubt about the severity or nature of a symptom, the default action should always be to escalate the concern for further evaluation by a physician. This systematic approach ensures that patient care is delivered ethically and in compliance with all applicable regulations. Question 13. Performance analysis shows that a patient presents with symptoms that may indicate compromised kidney function. As a certified clinical medical assistant, CCMA, understanding the fundamental processes of the kidney is crucial for effective patient care and support of the physician's diagnostic efforts. Which of the following accurately describes a primary structural component of the kidney and its essential function in waste removal? Option A. The collecting duct which reabsorbs water to concentrate urine. Option B. The glomerulus which filters blood to remove waste products and excess fluid. Option C. The kidney's primary role is blood pressure regulation through hormone secretion. Option D. The renal pelvis which collects urine before it passes to the bladder. Correct answer is B. The glomerulus which filters blood to remove waste products and excess fluid. Explanation. Scenario analysis. This scenario presents a common clinical situation where a patient exhibits symptoms suggestive of a kidney issue. The challenge lies in the medical assistant's role, which is to support the physician's diagnostic process by accurately gathering information and performing assigned tasks, while understanding the underlying physiological principles. Misinterpreting or miscommunicating findings related to kidney function can lead to delayed or incorrect diagnosis and treatment, impacting patient outcomes. The medical assistant must demonstrate a foundational understanding of kidney anatomy and physiology to effectively assist the healthcare team. Correct approach analysis. The correct approach involves recognizing that the glomerulus, a key structure within the nephron, is responsible for filtering waste products and excess fluid from the blood. This filtration process is crucial for maintaining electrolyte balance and producing urine. Therefore, understanding the role of the glomerulus in filtering blood is fundamental to comprehending kidney function and interpreting potential signs of kidney dysfunction. This knowledge directly supports the medical assistant's ability to assist in patient assessment and care related to renal health. Incorrect approach is analysis. One incorrect approach would be to focus solely on the collecting duct's role in water reabsorption. While important for concentrating urine, this function is downstream of the initial filtration process in the glomerulus. Overemphasizing this aspect neglects the primary filtering function, which is often the first indicator of kidney impairment. This demonstrates a superficial understanding of the nephron's overall function and could lead to misinterpretation of diagnostic findings. Another incorrect approach would be to attribute the primary function of waste removal to the renal pelvis. The renal pelvis is a collecting area for urine before it travels to the bladder. It does not actively filter blood or remove waste products from the bloodstream. This reflects a significant misunderstanding of kidney anatomy and the sequential processes involved in urine formation and waste excretion. A third incorrect approach would be to state that the primary function of the kidney is to regulate blood pressure through hormone secretion, without acknowledging the filtration role. While the kidneys do play a role in blood pressure regulation via hormones like renin, Their primary and most fundamental function is filtration and waste removal. Focusing exclusively on hormonal regulation without mentioning filtration is an incomplete and potentially misleading understanding of kidney function. Professional reasoning. Medical assistants must cultivate a strong understanding of basic human anatomy and physiology relevant to their scope of practice. This includes understanding the structure and function of major organs like the kidneys. When presented with patient symptoms, the medical assistant should be able to connect those symptoms to the underlying physiological processes. In situations involving potential kidney issues, recalling the glomerulus's role in filtration allows the assistant to better understand the significance of findings like elevated creatinine or protein in the urine, and to communicate these observations accurately to the physician. This knowledge base empowers the assistant to perform their duties effectively and contribute to patient safety. Question 14. The audit findings indicate that a patient with suspected acute kidney injury has inconsistent and incomplete documentation of fluid intake and output. Which of the following actions by the Certified Clinical Medical Assistant, CCMA, best addresses these findings and upholds professional standards for urine formation and elimination monitoring? Option A. Estimate the patient's total daily fluid intake based on general guidelines and only record the measured urine output, assuming other fluid losses are negligible. Option B. Record only the intravenous fluid intake and the urine output, as these are the most direct indicators of kidney function and fluid balance. Option C. Focus primarily on documenting the patient's subjective complaints regarding urination and defer detailed intake and output tracking to the nursing staff. Option D. Accurately measure and record all fluid intake, including oral fluids, intravenous fluids, and tube feedings, and meticulously document all fluid output, including urine, emesis, and stool, in the patient's electronic health record according to facility protocol. The correct answer is D. Accurately measure and record all fluid intake, including oral fluids, intravenous fluids, and tube feedings, and meticulously document all fluid output, including urine, emesis, and stool, in the patient's electronic health record according to facility protocol. Explanation. The audit findings highlight a critical area of patient care related to urine formation and elimination, specifically concerning the accurate documentation of intake and output, I&O, for patients with potential renal compromise. This scenario is professionally challenging because it directly impacts patient safety and the accuracy of clinical decision-making. Inaccurate I&O can lead to misinterpretation of kidney function, potentially delaying necessary interventions, or leading to inappropriate fluid management, which can have severe consequences for patients with compromised renal systems. The correct approach, meticulously documenting all fluid intake and output according to established protocols, represents best professional practice. This aligns with the CCMA role in accurate data collection, which is fundamental to patient care and is implicitly required by general healthcare standards and facility policies that emphasize precise record keeping. The CCMA is ethically and professionally obligated to ensure that all data entered into the patient's chart is factual and complete, as this forms the basis for physician assessment and treatment planning. Adherence to these protocols ensures that the healthcare team has a clear and accurate picture of the patient's fluid balance, crucial for managing conditions affecting urine formation and elimination. An incorrect approach of estimating fluid intake or neglecting to record all output, such as emesis or stool, represents a significant regulatory and ethical failure. Estimating intake is not a substitute for precise measurement and can lead to critical under- or overestimation of fluid balance, directly contravening the principle of accurate patient charting. Failing to record all output, including non-urine sources, means the I&O balance is fundamentally flawed, providing a misleading picture of the patient's physiological state. This failure violates the implicit duty of care to provide accurate information and can be considered a breach of professional conduct, potentially leading to adverse patient outcomes and regulatory scrutiny for the facility and the individual CCMA. Another incorrect approach, such as only documenting urine output and ignoring other fluid losses, demonstrates a lack of understanding of comprehensive fluid balance assessment, which is essential when evaluating kidney function. This oversight can lead to a false sense of adequate hydration or fluid management, when the patient may be experiencing significant fluid deficits or excesses. The professional decision-making process in such situations should involve a commitment to meticulous attention to detail, a thorough understanding of the patient's condition and the importance of accurate data, and adherence to all facility policies and procedures regarding patient care and documentation. When in doubt about what constitutes relevant intake or output, or how to accurately measure it, the CCMA should consult with a licensed nurse or supervisor to ensure correct practice. This proactive approach prioritizes patient safety and upholds the integrity of the patient record. Question 15. Analysis of patient presenting with a new onset of severe abdominal cramping, nausea, and a single episode of vomiting, who states they have not had a bowel movement in 3 days, requires a medical assistant to determine the most appropriate initial action within their scope of practice and regulatory guidelines. Which of the following approaches best reflects professional practice? Option A. Document the patient's symptoms and vital signs, then immediately inform the supervising physician or licensed healthcare provider of the patient's presentation for further assessment and direction. Option B. Advise the patient to take an over-the-counter laxative and drink plenty of fluids, as this is a common remedy for constipation. Option C. Reassure the patient that these symptoms are likely due to stress and will resolve on their own with rest. Option D. Provide the patient with a detailed pamphlet on various causes of bowel obstruction and their surgical interventions. Correct answer is A. Document the patient's symptoms and vital signs, then immediately inform the supervising physician or licensed healthcare provider of the patient's presentation for further assessment and direction. Explanation. Scenario analysis. This scenario presents a professional challenge because a medical assistant must interpret patient-reported symptoms related to the digestive system and determine the appropriate course of action within their scope of practice. Misinterpreting symptoms or providing inappropriate advice can lead to delayed diagnosis, worsening of the condition, or patient harm. The medical assistant must balance patient comfort and immediate needs with the necessity of adhering to established protocols and seeking appropriate professional consultation. Correct approach analysis. The correct approach involves actively listening to the patient's description of their symptoms, gathering relevant subjective and objective data, and then consulting with the supervising physician or licensed healthcare provider to determine the next steps. This aligns with CCMA scope of practice, which includes taking vital signs, documenting patient information, and assisting with examinations, but not diagnosing or prescribing treatment. The CCMA role is to facilitate accurate assessment by the physician. This approach upholds ethical principles of patient safety and beneficence by ensuring the patient receives care from a qualified practitioner. It also adheres to regulatory guidelines that define the boundaries of medical assistant practice, preventing unauthorized medical advice or interventions. Incorrect approaches analysis. One incorrect approach involves immediately recommending over-the-counter medications or home remedies. This is a regulatory and ethical failure because it constitutes practicing medicine without a license. Medical assistants are not authorized to diagnose conditions or prescribe treatments. Such an action violates the principle of non-maleficence by potentially masking symptoms or delaying proper medical evaluation, which could lead to adverse outcomes. Another incorrect approach is to dismiss the patient's symptoms as minor or insignificant without further assessment. This is an ethical failure related to patient advocacy and professional responsibility. It demonstrates a lack of diligence and could lead to a misdiagnosis of a serious condition, violating the duty of care owed to the patient. Regulatory frameworks emphasize thorough patient assessment and documentation. A third incorrect approach is to provide detailed explanations of potential digestive diseases and their treatments. While educational, this crosses the line into providing medical advice and diagnosis, which is outside the CCMA scope of practice. This is a regulatory violation and an ethical concern, as it may mislead the patient or cause undue anxiety without a confirmed diagnosis from a physician. Professional reasoning. When faced with a patient reporting digestive system symptoms, a medical assistant should follow a structured decision-making process. 1. Listen and document. Carefully listen to the patient's chief complaint and all associated symptoms. Document this information accurately and objectively in the patient's chart. 2. Gather objective data. Obtain vital signs and any other relevant objective data as per clinic protocol. 3. Assess scope of practice. Determine if the patient's reported symptoms fall within the CCMA scope of practice for initial assessment and documentation. 4. Consult and escalate. If the symptoms are concerning, new, or outside the CCMA direct assessment capabilities, consult with the supervising physician or licensed healthcare provider. Present the gathered information clearly and concisely. 5. Follow orders. Implement the physician's or provider's orders for further examination, testing, or patient education. 6. Maintain professional boundaries. Avoid offering diagnoses, prognoses, or treatment recommendations. Question 16. The assessment process reveals a 78-year-old patient complaining of generalized weakness, frequent muscle cramps, and dry mucous membranes. Their vital signs are within normal limits, but they appear slightly lethargic. Which of the following approaches best reflects a risk assessment for potential fluid and electrolyte imbalance? Option A. Advise the patient to drink more water and rest, assuming the symptoms are due to normal aging. Option B. Focus solely on the normal vital signs and reassure the patient that nothing is wrong. Option C. Document the patient's subjective complaints and objective findings and report them to the supervising physician for further evaluation. Option D. Immediately initiate intravenous fluid administration to rehydrate the patient. The correct answer is C. Document the patient's subjective complaints and objective findings and report them to the supervising physician for further evaluation. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the medical assistant to identify subtle signs of potential fluid and electrolyte imbalance in a patient who may not be able to clearly articulate their symptoms. The risk assessment component is crucial, as delayed or incorrect identification can lead to serious patient harm, including cardiac arrhythmias, neurological dysfunction, and even death. The medical assistant must synthesize multiple pieces of information: patient history, vital signs, and observed physical signs to form a preliminary assessment. Correct approach analysis. The correct approach involves recognizing that the patient's symptoms, such as generalized weakness, muscle cramps, and dry mucous membranes, are classic indicators of potential dehydration and electrolyte disturbance. This approach aligns with the CCMA role in patient assessment and the importance of recognizing deviations from normal findings. The CCMA is expected to observe, document, and report such findings to the licensed healthcare provider, initiating the process for further diagnostic evaluation and treatment. This adheres to the principle of patient safety and the scope of practice for a CCMA, which includes gathering patient data and reporting it promptly. Incorrect approaches analysis. One incorrect approach is to dismiss the patient's symptoms as simply feeling tired or normal aging. This fails to acknowledge the potential seriousness of the signs and represents a failure to perform a thorough risk assessment. Ethically, this is a breach of the duty of care, as it neglects potential patient suffering and deterioration. Legally, it could be considered negligence if harm results from this oversight. Another incorrect approach is to immediately administer intravenous fluids without a physician's order. This is a significant violation of the CCMA scope of practice. Administering medical treatments, especially invasive ones like Roman IV therapy, requires direct supervision and prescription from a licensed practitioner. Failure to adhere to this regulatory boundary can lead to legal repercussions and patient harm due to inappropriate treatment. A third incorrect approach is to focus solely on the vital signs and ignore the subjective complaints and physical observations. While vital signs are important, they may not always reflect the full picture of a patient's condition, especially in the early stages of fluid and electrolyte imbalance. Over-reliance on a single data point, without considering the totality of the patient's presentation, is a failure in comprehensive assessment and risk identification. Professional reasoning. When faced with a patient presenting with multiple, albeit nonspecific, symptoms, a professional medical assistant should employ a systematic risk assessment. This involves 1. Actively listening to and validating the patient's subjective complaints. 2. Performing a focused physical assessment, observing for objective signs such as skin turgor, mucous membrane moisture, and any signs of muscle weakness or cramping. 3. Correlating these findings with objective data like vital signs. 4. Recognizing potential patterns indicative of common medical conditions, such as fluid and electrolyte imbalances. 5. Promptly and accurately documenting all findings and reporting them to the supervising licensed healthcare provider for further medical evaluation and management. This structured approach ensures patient safety and adherence to professional standards and regulatory requirements. Question 17. Quality control measures reveal that a patient undergoing a routine physical exam has asked for a clearer understanding of the female reproductive system. The medical assistant is tasked with providing this education. Which of the following explanations best aligns with the CCMA role and the need for accurate, patient-centered information? Option A. Explaining the external vulva, including the labia majora and minora, and then describing the internal organs such as the uterus, fallopian tubes, and ovaries, detailing their basic functions. Option B. Briefly mentioning that the female reproductive system includes external parts and internal organs responsible for reproduction, without going into specific anatomical detail. Option C. Describing the female reproductive system using highly technical medical terminology, assuming the patient has a strong medical background. Option D. Using analogies and simplified terms to describe the reproductive organs, focusing on their general purpose rather than precise anatomical names. The correct answer is A. Explaining the external vulva, including the labia majora and minora, and then describing the internal organs such as the uterus, fallopian tubes, and ovaries, detailing their basic functions. Explanation. This scenario presents a professional challenge because it requires the medical assistant to navigate patient education regarding sensitive anatomical and physiological information while ensuring accuracy and respecting patient privacy. The challenge lies in providing clear, concise, and anatomically correct information without overstepping the scope of practice or causing patient distress. Careful judgment is required to tailor the explanation to the patient's understanding and to maintain professional boundaries. The correct approach represents best professional practice because it directly addresses the patient's stated need for information in a clear, accurate, and anatomically precise manner, aligning with the CCMA role in patient education. This approach prioritizes patient understanding and empowers them with accurate knowledge about their bodies, which is a fundamental aspect of patient care and adherence to treatment plans. It adheres to ethical principles of beneficence, acting in the patient's best interest, and autonomy, respecting the patient's right to information. An incorrect approach that focuses solely on the external genitalia, without acknowledging the internal structures, fails to provide a comprehensive understanding of the reproductive system. This is a regulatory failure, as it does not meet the standard of providing accurate and complete information within the scope of patient education. Another incorrect approach that uses overly simplistic or colloquial terms can lead to misunderstandings and a lack of precise knowledge, which is a failure in professional communication and patient education standards. Using overly technical jargon without explanation is also an incorrect approach, as it hinders patient comprehension and can be perceived as dismissive or condescending, failing to meet the ethical obligation to ensure patient understanding. The professional decision-making process for similar situations should involve first actively listening to the patient's specific request for information. Then, assess the patient's level of understanding and tailor the explanation accordingly, using clear and accurate terminology. Always ensure the information provided is within the scope of practice for a CCMA, which includes patient education on anatomy and physiology. If the patient's questions extend beyond this scope, it is essential to involve the physician or other appropriate healthcare provider. Maintaining patient confidentiality and dignity throughout the interaction is paramount. Question 18. Research into the documentation of patient range of motion assessment reveals a need for precise anatomical and kinesiological terminology. A certified clinical medical assistant, CCMA, is tasked with recording the movement of a patient's limb. Which of the following descriptions demonstrates the most accurate and professionally appropriate documentation of a joint movement? Option A. Moving the leg outwards. Option B. Bending the arm. Option C. Flexion of the elbow. Option D. Moving towards the midline. The correct answer is C. Flexion of the elbow. Explanation. Scenario analysis. This scenario presents a common challenge in clinical settings where a medical assistant must accurately document patient range of motion (ROM) assessments. The challenge lies in precisely identifying and articulating the specific joint and the type of movement being performed, as misdocumentation can lead to incorrect treatment plans, insurance claim issues, and potentially impact patient outcomes. The need for precise anatomical and kinesiological terminology is paramount. Correct approach analysis. The correct approach involves clearly identifying the joint and the specific movement. For example, stating flexion of the elbow is accurate because it names the joint elbow and the specific movement flexion, which decreases the angle between the forearm and the humerus. This precision aligns with the need for clear, unambiguous medical documentation as required by healthcare regulations and best practices, ensuring continuity of care and accurate billing. The CCMA certification emphasizes proficiency in clinical documentation, which includes accurate anatomical and movement terminology. Incorrect approaches analysis, describing the movement generically without specifying the joint, such as bending the arm, is insufficient. This lacks the necessary anatomical specificity required for medical records and could be interpreted as referring to the shoulder, wrist, or even the hip, leading to confusion. Using imprecise or colloquial terms for movements, such as moving the leg outwards, instead of a specific term like abduction of the hip, introduces ambiguity. Medical documentation demands standardized terminology to ensure universal understanding among healthcare professionals. This failure to use precise kinesiological terms violates the principles of accurate medical record keeping. Focusing solely on the direction of movement without naming the joint, like moving towards the midline, is also inadequate. While it describes a direction, it doesn't specify which joint is involved, making the documentation incomplete and potentially misleading. This highlights a lack of understanding of fundamental anatomical and biomechanical principles expected of a certified medical assistant. Professional reasoning. Medical assistants should approach documentation by first identifying the specific joint being assessed. Then, they should recall or refer to the standard kinesiological terms for movements flexion, extension, abduction, adduction, rotation, etc., that describe the action performed at that joint. If unsure, consulting anatomical charts, kinesiology resources, or a supervisor is a professional and ethical step to ensure accuracy. This systematic approach ensures that documentation is precise, compliant with regulatory standards for medical records, and supports effective patient care. Question 19. System analysis indicates a patient presence to the clinic complaining of generalized abdominal discomfort. When asked to pinpoint the location, the patient gestures vaguely to the central and upper regions of their abdomen. Based on your understanding of the gastrointestinal tract's anatomy, which of the following actions would be most appropriate for a certified clinical medical assistant to take to assist the physician in diagnosis? Option A. Tell the patient that abdominal discomfort is common and they likely just need to rest. Option B. Ask the patient if they have recently eaten anything unusual and assume the discomfort is related to indigestion. Option C. Immediately document the complaint as gastric distress and advise the patient to avoid fatty foods. Option D. Inquire further about the specific characteristics of the discomfort, its onset, duration, and any associated symptoms, while noting the general area indicated by the patient. The correct answer is D. Inquire further about the specific characteristics of the discomfort, its onset, duration, and any associated symptoms, while noting the general area indicated by the patient. Explanation. Scenario analysis. This scenario presents a common challenge in clinical settings where a patient's symptoms are vague and could potentially stem from multiple gastrointestinal issues. The medical assistant must rely on their understanding of the anatomy and physiology of the GI tract to accurately gather information and assist the physician. Misinterpreting the location or nature of the pain can lead to incorrect reporting, delayed diagnosis, and potentially inappropriate treatment, impacting patient care and safety. Correct approach analysis. The correct approach involves systematically gathering information about the patient's symptoms, specifically focusing on the location, character, and timing of the abdominal pain. This aligns with best professional practice by directly supporting the physician's diagnostic process. Understanding that the stomach is primarily located in the upper left quadrant, and the small intestine occupies the central abdominal region, while the large intestine encircles the periphery, allows the medical assistant to ask targeted questions. For instance, pain localized to the epigastric region might suggest gastric distress, while diffuse central pain could point towards small intestinal involvement, and pain in the lower right quadrant could be indicative of issues with the cecum or appendix, part of the large intestine. This detailed reporting is crucial for accurate charting and communication, adhering to the CCMA role in patient care and documentation, as outlined by relevant U.S. healthcare regulations and ethical guidelines that emphasize accurate patient assessment and communication. Incorrect approaches analysis. One incorrect approach involves assuming the patient's description of stomach ache definitively means a problem with the stomach itself, without further inquiry into the precise location and nature of the pain. This is a regulatory and ethical failure because it bypasses thorough patient assessment, potentially leading to miscommunication with the physician and overlooking other significant GI tract structures that could be the source of the pain. For example, pain in the lower right quadrant, often associated with the appendix part of the large intestine, might be incorrectly attributed to the stomach if the assistant doesn't probe for specific location. Another incorrect approach is to dismiss the patient's complaint as minor without gathering detailed information. This violates the ethical obligation to provide diligent care and the regulatory requirement for accurate patient charting. Ignoring or downplaying symptoms can lead to delayed diagnosis and treatment, which is a breach of professional responsibility. A third incorrect approach is to provide the patient with unsolicited medical advice or diagnostic opinions. This is a significant regulatory and ethical violation, as it exceeds the scope of practice for a CCMA and could lead to patient harm. The CCMA role is to collect information and assist the physician, not to diagnose or treat. Professional reasoning. When faced with a patient presenting with abdominal pain, a medical assistant should employ a systematic approach. First, actively listen to the patient's chief complaint. Second, ask open-ended questions to gather more detail about the pain, including its exact location, character, sharp, dull, cramping, duration, frequency, and any alleviating or exacerbating factors. Third, correlate the reported location of pain with knowledge of the gastrointestinal tract's anatomy. Fourth, accurately and objectively document all findings in the patient's chart. Finally, communicate these findings clearly and concisely to the supervising physician. This structured approach ensures comprehensive data collection, supports accurate diagnosis, and upholds professional standards of care. Question 20. The performance metrics show a comparison of a patient's measured respiratory volumes and capacities against established norms. Which of the following interpretations most accurately reflects a clinically relevant understanding of these metrics for a certified clinical medical assistant? Option A. Vital capacity is the amount of air remaining in the lungs after a normal exhalation, and tidal volume is the maximum amount of air that can be forcefully exhaled after a maximal inhalation. Option B. Residual volume is the amount of air exhaled during a normal breath, and functional residual capacity is the amount of air remaining in the lungs after a maximal exhalation. Option C. Inspiratory reserve volume is the additional air that can be inhaled beyond a normal tidal volume, and expiratory reserve volume is the additional air that can be exhaled beyond a normal tidal volume. Option D. Total lung capacity represents the maximum amount of air a person can exhale after a normal inhalation, while vital capacity is the total amount of air the lungs can hold. The correct answer is D. Total lung capacity represents the maximum amount of air a person can exhale after a normal inhalation, while vital capacity is the total amount of air the lungs can hold. Explanation. This scenario presents a professional challenge because it requires a clinical medical assistant to interpret and apply knowledge of respiratory volumes and capacities in a practical, patient-centered context, rather than just recalling definitions. The challenge lies in understanding how these physiological measurements relate to patient assessment and care, and how to communicate this understanding appropriately. Careful judgment is required to differentiate between accurate and inaccurate interpretations of these metrics, ensuring patient safety and adherence to clinical protocols. The correct approach represents best professional practice because it demonstrates a thorough understanding of respiratory physiology and its clinical implications. By correctly identifying the relationship between different lung volumes and capacities, the assistant can contribute to accurate patient assessment, assist the provider in diagnosis, and ensure appropriate patient education. This aligns with the CCMA role in supporting patient care and adhering to established clinical guidelines, which implicitly require a foundational understanding of physiological parameters. An incorrect approach that focuses solely on memorizing definitions without understanding their clinical significance is professionally unacceptable. This failure stems from a lack of applied knowledge, which could lead to misinterpretation of patient data and potentially impact care decisions. Ethically, this represents a failure to maintain competence and provide accurate support to the healthcare team. Another incorrect approach that misattributes the function of specific respiratory volumes. such as confusing inspiratory reserve volume with expiratory reserve volume, demonstrates a fundamental misunderstanding of respiratory mechanics. This can lead to incorrect assumptions about a patient's respiratory status, potentially delaying or misdirecting diagnosis and treatment. This is a direct violation of the professional standard of care, which mandates accurate data interpretation. A third incorrect approach that oversimplifies the interpretation of respiratory volumes without considering the patient's clinical presentation is also professionally unacceptable. Respiratory volumes are not interpreted in isolation. They must be considered within the context of the patient's symptoms, medical history, and other diagnostic findings. Failing to integrate these factors can lead to a superficial and potentially misleading assessment, undermining the collaborative nature of patient care and potentially violating ethical principles of thoroughness. The professional decision-making process for similar situations should involve a systematic approach. First, accurately recall and define the relevant physiological concepts, respiratory volumes, and capacities. Second, understand the clinical significance and application of each concept in patient assessment. Third, critically evaluate any presented data or interpretations against this foundational knowledge in clinical context. Finally, communicate findings and interpretations clearly and accurately to the supervising healthcare provider, ensuring patient safety and optimal care.